Good evening. My name is Richard Kukuru, and I am the President and CEO of Gosnold, and I want to thank you all for coming here tonight. I want to take a moment to acknowledge a few people in the room. Sam Patterson, Falmouth Selectman, Mike Miller, Sandwich Selectman, and Doug Brown, Falmouth Selectman. Thank you for being here. I want to open our community meeting by extending a warm welcome and thanking you all for being here tonight. This is an important time for patients, families, and the communities we serve at Gosnold, especially the Falmouth community, which has been our home for 46 years. We come together this evening because we care about our community. We care about the community needs related to substance misuse and mental health challenges. And we care about working together, collaboratively and in full transparency. I want to lay out the evening for you tonight. Beth Fokker, Chief Operating Officer of Gosnold, will provide some background information on the services Gosnold provides, and in particular, for the specific services related to our proposed relocation and expansion at 359 Jones Road. After Beth speaks, I will come up and share some comments with you about the specifics and understand them as we understand them today related to the proposed facility and its services, as well as the anticipated timeline. And then Beth and I will open up the meeting because we want to hear from you. That's what tonight is about. Every topic is on the table. It's important. We want to hear your comments. We want to hear your concerns. We want to answer your questions. We want to be here for you, for this community. If we can't answer a question tonight, our promise to you is to provide that answer to you as soon as possible. As I said, this is an important evening for this community and for Gosnold, and we appreciate you being here tonight. Beth.
Good evening, everyone. Thank you for being here. My name is Beth Fokker. I'm Chief Operating Officer for Gosnold, and I've been serving the organization for 2 years, but I have spent my entire professional career in the behavioral health sector, in community behavioral health, really helping patients with substance use and mental health conditions link to the services that they so desperately need. As recently announced in the press, and also through various media, we're so excited at Gosnold to announce the proposed relocation and expansion of the Gosnold Treatment Center, our flagship program at Gosnold, presently located at 200 Terhune Drive in Falmouth. This is such an exciting time for Gosnold, but also for the thousands and thousands of patients that we serve each and every year. Over recent years, our organization has worked hard to keep pace with what seems to be an ever-increasing need for services directed towards substance misuse and co-occurring mental health challenges that often go hand in hand with substance misuse. People who struggle with substance use disorders most often do have a co-occurring mental health condition. These include depression, anxiety, post-traumatic stress, and other conditions. Nearly every person I know, at least those who I know well enough to them to share just a little bit about their family, has a family member or dear friend affected by substance use and mental health concerns. At Gosnold, we treat your mom, we treat your dad, your son, your daughter, your grandparents, your nieces, your nephews, and your friends. Substance use does not discriminate by education, socioeconomic status, age, or livelihood. At Gosnold, we treat the attorney, the banker, the real estate agent, elected official, professional athlete, college athlete, wait staff, doctor or nurse, student, accountant, teacher. I hope you understand my point. These health challenges do not discriminate, and each year, some people find their way to recovery, to a new beginning, to restored health, and sadly, others lose the battle. Substance use disorders are progressive diseases. When untreated and unaddressed, people perish as a result. That's why our work at Gosnold is so very important. It is literally a life or death proposition. I think each of us would be hard-pressed to deny the need for Gosnold Services. We see the need in our families, in our schools, in our communities, in our places of worship. Yet, we understand at Gosnold that our proposed relocation and expansion gives rise to legitimate questions and concerns. We've called this meeting this evening because we care about our community. We want to extend our very best effort to hear and respond to your viewpoints in the most transparent way that we can. Before I delve into the very specifics, the specific reasons why we believe this relocation and expansion is so necessary, I'd like to tell you a little bit about Gosnold. Gosnold was incorporated in 1972. We were originally known as the Cape Cod Alcoholism Intervention Unit, CCAIRU, but became Gosnold, let me just put this, there we go, but became Gosnold a decade later in 1982. While mostly known for our acute and rehabilitative services on 200 Terhune Drive, otherwise known as Gosnold Treatment Center, Gosnold is a full-service community behavioral health organization serving southeastern Massachusetts, Cape Cod, and the islands. Our programs and services are duly licensed by the Commonwealth of Massachusetts, and we are nationally accredited by the Joint Commission. Our continuum includes inpatient services, intensive inpatient rehabilitation. Those are the services at 200 Terhune and also Gosnold at Katomet. Extended residential care, the Miller House for Men and the Emerson House for Women, partial hospitalization in Stoughton and in Centerville, and school-based services. Few people know about this. Gosnold is in 40 schools, and all 7 schools in Falmouth. And we hope that in the fall of 2018, we do expect to be in 50 schools across Cape Cod and southeastern Massachusetts. Gosnold also has a full range of outpatient clinic services in North Dartmouth, Stoughton, Falmouth, Centerville, Orleans, Provincetown, Nantucket, and also outreach sites in the outer and lower Cape regions where it's hard for people to get to services, so we go to them. In recent years, Gosnold has been at the forefront in delivering community-based recovery management services. We employ adults who are mature in their own recovery, and I see a lot of them here tonight, so I thank you to our recovery management staff who are supporting this evening. We employ people who are mature in their recovery to support others who are early on their journey. Gosnold has a team of certified coaching staff, family interventionists, and emergency department navigators who are embedded in Falmouth, Cape Cod, South Shore, and soon to be Beth Israel Deaconess Hospital emergency departments. And what we do there is we help patients who present with a substance use issue to connect with services in the community. Falmouth has long been home to Gosnold since our humble beginnings as a singular unit for the treatment of alcoholism. The organization has come such a long way in 46 years. We serve hundreds of thousands of patients over our tenure. At Gosnold Treatment Center alone, we serve well over 3,000 patients in our acute and intensive rehab programs in the last fiscal year, and that's pretty much standard over the last decade or so. Gosnold operates at near full capacity every day, 365 days a year, full throttle. Our agency's unsung heroes are our medical staff, our nursing, our clinicians, who literally save the lives of your family, friends, and loved ones. Our community's unsung heroes, our police, rescue, hospital, social service agencies who work side by side with us at Gosnold to ensure the care and protection of our citizens and the safety of our overall community. We employ more than 420 staff. We have a budget of about $26 million annually, a biweekly payroll of $720,000. Most employees are Cape-based, and for our operations here in Falmouth, we strongly pull from the Falmouth community and for our local workforce. We are an integral part of the social, economic, and cultural fabric of the Falmouth community, and we're very proud of that. As a nonprofit organization with a mission to excel in the treatment of substance use and mental health problems, Gosnold has consistently evolved to meet the continuing and emerging needs related to our purpose. Our purpose. This is what our Jones Road project is all about: evolving, expanding, and responding to needs in the community. There are three prevailing reasons that underlie our proposed relocation and expansion. At the highest level is the grave need for expanded services for the treatment of substance misuse and associated mental health challenges. Estimated opioid-related deaths continue to plague the Commonwealth communities. In 2012, there were 698 deaths. In 2015, there were 1,768. In 2016, 2,155 opioid-related deaths in the Commonwealth. And in 2017, there were 1,977. The rate per 100,000 per capita increased more than 100% in 5 years. The major factor related to this sharp increase in opioid-related deaths is the proliferation of illicit fentanyl. It has had a deadly impact. The Office of the Chief Medical Examiner does full toxicology reports for these particular cases, and did so for 1,262 cases in 2017. 83% of those cases had the presence of fentanyl. Other substances included heroin and benzodiazepines and cocaine. So we understand that our work at Gosnold corroborates this. We know most people consume multiple substances, especially as their disease progresses. They tend to use polysubstances. So what about the conditions here locally? The Department of Public Health classifies Massachusetts counties related to per capita deaths related to opioid overdose. Barnstable County is classified at the highest level and has been there since January 2011. Presently, Barnstable and Dukes counties are in the highest category, 23.1 to 32.9 opioid-related deaths per 100,000 residents. We see here that in our local communities that have been really hard hit by opioid-related deaths, and that our first responders see the ravages of opioid use firsthand, with a projected 1,000 EMS interventions recorded related to opioid use. That's here on the Cape. 1,000 EMS interventions related to opioid use in a singular year. State statistics indicate Narcan was administered statewide nearly 13,000 times during the first 3 quarters in 2017. We know, too, that alcohol continues as the primary misuse substance. A 2017 report by the Barnstable County Department of Human Services indicates problematic alcohol use among youth. It continues, and more than 15,000 Cape Cod residents are affected with an alcohol-related substance use disorder. This is nearly 8% of the population. So the need for expanded services is clear. there really is a significant and enduring need for the work we do at Gosnold. We also know from our organizational experience and patient data at Gosnold that nearly 80% of people struggling with addiction also have a co-occurring mental health condition. Major depression, anxiety, PTSD. Those are the conditions we see most prevalently. Yet, there are only 5 dually licensed facilities in the Commonwealth with this specialized capacity. This capacity to treat both substance use and mental health at the same time. And none of these facilities is located in the southeastern Massachusetts or Cape Cod region. In fact, if you need services for a co-occurring mental health and substance use disorder by a specialized facility, dually licensed, you need to travel to Jamaica Plain, Belmont, Webster, or Brookline. And that's the extent of the services. Inpatient services for adults with co-occurring substance use and mental health challenges are very, very much needed on the Cape. And Richard will be coming up momentarily to speak more on this and to describe what our proposed site at Jones Road is going to look like. Finally, we also listen to the feedback provided to us by our patients and their families. Addiction is a chronic disease, and it requires sustained treatment and recovery management services. Gaining access to the appropriate level of care, coordinating admission, and having necessary resources in place to complete treatment are very real system barriers. For individuals and families here today, and I do recognize a couple in the room who have been through this, you well understand the stress and the strife associated with getting access to needed services. The demand simply exceeds the supply of services, and people in great need often have to wait. Doing so, they can miss the window of opportunity they need, the window of readiness that we understand in our field is so important to beginning the recovery process. With a full range at Jones Road of detoxification, intensive rehabilitation, and inpatient services for adults affected with co-occurring disorders, Gosnold will be able to meet a grave need in our community. Thank you, and I'd like to turn the podium back over to Richard. Thank you very much.
Thank you, Beth. This project did not go through, it has not been planned without a lot of thought. We have been looking at this project for about a year. We understand the concerns all of you must share in this room. I'm a parent, I have 2 children. I get it. The point of tonight is really to help you understand that this is a much needed service. This expansion is here to benefit the communities, the towns of the Cape Cod. Do you want to advance it, Beth? So currently Gosnold at Terahune has 35 detox beds. The proposed initiative at Jones Road expands those beds to 54, an incremental increase of 19 beds. We are turning away people every single day. We can't meet the needs and the capacity of Cape Cod. I'm not sure you can understand how difficult it is for our staff to be able to say no to somebody in need, but we have to do it all the time. It's not something we want to do. The plan, currently we have 15 beds of rehabilitation at Terahune. We believe that this is sufficient because of our Katomet facility, so we're not asking to increase that bed capacity at all. Part of the reason for this, as Beth described, is really the last initiative here, which is the inpatient unit for co-occurring disorders. That's a 30-bed inpatient unit, secure facility for patients who have both mental illness and substance use disorder. We are turning away people every single day with co-occurring disorders because we don't have the capacity to treat this population. I had a call from a gentleman not that long ago struggling with his son's addiction and mental illness. Wanted us to accept him into Gosnold because he's a Cape family. We just couldn't do it. It wouldn't be right to accept him, so I had to refer him to Brookline. From what I understand, his son is doing very well. It's unfortunate that this family had to travel every single day to Brookline to participate in their son's treatment. We know the need for this. I may be the CEO and president of Gosnold, but I'm also a clinician. For many years, I spent working with this population. I know the need for these secure beds. I know it can benefit our communities, and I know it can benefit the patients and the families we serve. So there are 5 important steps to the startup. One of them is tonight, is the beginning of it. Continue to work with the community to promote understanding, trust, and engage in productive dialogue. We want to hear from all of you tonight. We want to hear your concerns. We want to answer your questions. We've begun to work with local authorities, helping us understand the planning, permitting, and zoning, and really address the recommendations offered by local authorities. Once that happens, we move into purchase and renovation. If all goes as we hope it will, we look at renovating come fall, licensed through DPH, Department of Public Health, DMH, Department of Mental Health, and then look at opening this facility sometime after the first of the year. There's a lot of new staff. There's a lot of new training that needs to happen as a new unit is being proposed like this. But as a community, we can come together and do this. We know it's needed, and we hope you can support us. So Beth and I are going to answer questions. We have the room till 7:30 tonight, so there's no hurry. Again, there's no question that's not on the table here tonight. There are people who have microphones, so people are going to walk around.
Michael Halen, Cliffwood Lane, and Falmouth. Both of you said that this is for the folks in our community. So maybe I'm wrong, but you're only going to allow folks from Falmouth and the surrounding towns at this facility?
No, I don't think we said it was just about this facility, about this community. We said it's going to serve this community. But the hope is that we're going to serve all of Cape Cod and predominantly southeastern Mass, because that's really where the need is.
So is there a pecking order from people in Falmouth get first crack, or is it just first come, first serve? Because
it's really about acuity. It's really about the patients who are in most need of these services. It's like a triage. So when you walk into an emergency room and there's a patient who's in dire need, the patient who has a gunshot wound will certainly get the care more than the patient who has the flu. So we're gonna do an assessment of these patients like any good clinical organization would.
Okay, so this doesn't, I mean, you have 84 beds, and this doesn't necessarily, those 84 beds, there could be nobody from Falmouth in them, and you could be sending 84 people from Falmouth to Brookline still. This isn't a Falmouth gets first crack, it's whoever is first on your first come, first serve. So this doesn't really help out, this doesn't help out Falmouth people who are struggling.
I can say that based on our current occupancy and the current trends at our treatment center, that 15% of the population that we serve comes from the Falmouth community. 15, yes. Yep, 15, yeah. No, 15 of the people we serve on an annual basis, 15%. 30% come from Cape Cod, and of the 30%, 15 are from the Falmouth community.
A little higher, I'm not that small. Okay, that's great. So 15% of the beds are from Falmouth, and how many of our Falmouth children go to Morse Pond School? 100%. So what's more important, the 15% from, if the whole place was Falmouth only, that's great. But it's not. You're gonna bring people from anywhere, first come, first serve, and all of our children are in that school right there. So explain, can you make it Falmouth only?
Why would, I mean, making it Falmouth only does not help to serve the rest of the population. It does not serve the,
Because both of you said this is for the benefit of the community of Falmouth. That's what you said, and it's benefiting 15% of your patients from Falmouth, and it's possibly going to affect 100% of children from Falmouth. Does that make sense?
Would be happy to talk about the concerns related to the school, because that's what I hear you saying, is that there are concerns with kids at Morse Pond and it being located next to Morse Pond. So if someone wants to speak, ask questions related to that, we'll be happy to talk about that.
right behind you.
Sarah?
You got the Moss Pond School. I drive school bus 11. I know where you are, Gosnold. I used to go up there. I did not allow any of the kids in the bus to get out there and walk because sometimes you have outpatients walking down the street and there's no sidewalks. So I consider it a danger because of the school. What safety precautions are you going to go for the schools? Moss Pond. That's what I'm worried about. I'm worried about more than anything else. That's my answer. What are you going to do? You put a wall up? Because what you do, you get stuff also from the probation department. They send people to you as a patient, which is nothing wrong. The problem is some of them are sexually perverts, and they focus on the kids on the school. So it scares the hell out of me.
So
That's why I'm here.
So let's talk about it, okay? We hear you. I appreciate it. It's a good point, and we want to address that point.
Hi, everyone. I'm Gretchen Schwanman. I am an alumni of Gosnold. I also have been employed there for 4 years. I have a 7-year-old son who's with me tonight. I'm a Falmouth resident. And all of the statistics that they shared are true. Like, that's data, but I've seen these families have to bury their children. And I know the absolute worst thing you can say is not my child. I will never say that about my son. There is an epidemic going on that is taking thousands of Massachusetts residents by the day. And I know just as easily 10 years from now that could be my son. And if it is, I want him to have the services he needs. I don't want him not to have a bed available because people are scared. We take every single precaution. Whenever anyone leaves our facilities without an aftercare plan, we drive them off the facility into the bus station. We don't just let people out into the town. And like, I have become, because of Gosnold, like, I have a beautiful life today. I just graduated, I'm going for my master's. My parents raised me like all of you raise your children. They were great, amazing parents, and I ended up with this illness. But that doesn't mean that I don't have a right to life. That doesn't mean that I don't have a right to services. And as far as like the Cape Cod residents, and it's gonna create jobs for hundreds of people in this community. That benefits the town. 15% served throughout the year is hundreds of thousands of people that we're serving in Falmouth on a yearly basis. Like thousands. It's helping everyone. You can't make it that just people from Falmouth. Everyone needs help. Like, we're all human beings. No one's better than one another. And I understand the concerns. I have the same concerns, but like, this is an illness that affects everyone. It can affect your child one day, and if your child needed services one day, you can bet that you'd want them available for them. So, thank you.
I think that Gosnold does a great thing. Everybody in this room would agree probably that you guys are doing a good thing, and this is a good setup. It's just not a good setup in the area you want to put it. Most of these situations with mental health facilities, how many are a handshake away from an elementary school? And can you guarantee unequivocally that nothing is going to happen to one student at that school from somebody going in and out of your Gosnold building. Because yes, you create jobs, yes, it's a good thing, but if one kid in that school gets molested or hurt, it's not worth it. So if you can guarantee that, and you can put in writing all your stipulations you're gonna have before this goes into effect, and then we can see it before we okay it, then maybe you'll get more people on board. But right now, I know when you watch the news, most of the people that are child molesters, criminals, have a drug background or a mental illness background. So that's what you're taking in. So until they're rehabbed, we don't know what's going to happen. It's a new situation being next to a school, and ignorance can be dumb sometimes, but you have to look out for the kids because they should come first.
I don't necessarily think that putting the program next to a school means that we can't be mutually exclusive around treating this population. I've been working in this field for over 30 years. A lot of the psychiatric facilities that are in Massachusetts currently are located in residential facilities. They are located in towns. They are adjacent to families' homes. They are adjacent to communities. Gosnold has a 46-year reputation in this town. And there has been no significant adverse reactions to any town, to any member of this town as a result of Gosnold's programs. We have provided a safe, secure environment. To answer your question, we don't have any plans to have people discharged and walking around the building. I understand. But that's because we provided outpatient services there. We don't plan to provide outpatient services at this site. It will be inpatient services.
Go outside near the school, that's all I'm saying.
So,
There'll be some kind of protection against the kids.
and we will,
What they do, they focus on the kids. I know because I'm involved with that stuff too. I
so-
was in mental health.
so-
I did mental health. I was a social worker. I was involved in all that crap. Respectfully, I don't mean to be nasty, but I'm just saying, you gotta be careful.
I think it's unfair to equate patients with substance use disorders as child molesters. That's unfair. We understand the concerns around patients who are sex offenders, violent patients. For anything that we are aware of, we have no intention of accepting that population in this facility.
I'd like to also just speak to our safety record, because I think it matters. History does matter, because even we say to our children when they apologize, like, apologize through future behavior. The best predictor of future behavior is past behavior. We really have an exceptional record of safety where we deliver services right now. The VNA child care services are just steps away. We contacted our neighbors in preparation for tonight, and we spoke with one woman who said, I've been next to Gosnold for more than 30 years, and you are the best neighbors. I have never had a concern. The way you conduct your business is commendable. So I want to just talk about a little bit about what we have in place and what we plan to do, because it really does, we do take safety seriously in our programs. People come to us at their most vulnerable point. They're very, very sick. They're sick in a lot of different ways, physically, psychically, and so we have to really monitor our environment closely. We have camera systems everywhere. We have staff eyes and ears everywhere. It depends on the we will change some of our procedures to accommodate the new service, hire some security, which we don't have now, but with a new facility and increased beds, with the school in proximity, we're prepared to do that. Obviously, the wall right now in between the Morse Pond School and the facility is in severe disrepair. We would have a solid barrier there, a solid, attractive fence within that conforms with ordinances. Richard and I walked the path the other day. There's a path behind Morse Pond School that goes all the way to the senior center. And so we're very cognizant, as we are now, cognizant of where our patients are, how they're monitored, how they're checked. I mean, to run a facility with so few issues consistently for decades speaks volumes about the operations at Gosnold.
Oh, you have to hold it. Okay, sorry. Hi, my name's Sarah. I have one student at Morse Pond right now, and I have another one in T-Ticket, soon to be at Morse Pond. I just want to start by saying that I work with substance abuse and mental illness, and nobody in this room is going to negate the fact that Gosnold does a great job and our community needs this service, right? The concern in this room, I think, the consensus is the location, right? So as a mom, I can't sell cookies on school property outside without a Corey check. Do you Corey check each and every person that comes into your facility? You
No.
say here that you're going to do your best. So when sex offenders or violent crime history is known, Gosnold will refer to an appropriate facility. How do you know that? Patients have to willingly tell you that information.
Not necessarily. A lot of the patients will be referred by outside agencies, outside providers, outside treaters, other hospitals. Usually that's done with a complete and thorough psychiatric evaluation. So we're not just taking patients who are walking in our doors saying that they want to be admitted. The majority of these patients will be referred by other mental health professionals.
Right, but there are times when patients do come in that you really don't know what their criminal history background is. You may know what their psychiatric background is. You may know what's happening right now, but you don't know that 15 years ago they were, in prison for whatever.
We don't
Now-
know that. We don't know that now, and we haven't had any adverse issues on Terre Haute in the 46 years we've been there.
But you're not 53 feet from a school. That's the issue. That's the biggest issue. Now you're going to build a wall. I think that's great because there's, a 6-foot fence there right now that I myself could scale, right? So you're going to put a wall that, right here it says it's non-scalable height. Now what's stopping the drug dealers from stuffing drugs inside a tennis ball and throwing that over the fence? Now my son's outside, he's at recess, and he says, oh look, it's a tennis ball. Next thing you know, there's drugs inside that tennis ball. It's not just a normal tennis ball that got away from them when they were outside playing recess. How are you going to prevent that? What else? Right now, in Falmouth alone, there are 36 total, and this is according to the Falmouth Human Services website, 36 total sober houses right now in Falmouth. So we're bringing more people in. Not just from Falmouth, which is fine because everybody needs services, right? So they're going to come from all over the state of Massachusetts and beyond. They're coming. What percentage of them go back to where they came from? I bet you there's a lot higher percentage that stays. So then where do they go? They stay within our community, which means that number 36, that's going to go up a lot, right? And 14 of them are certified, but 22 of them are non-certified sober houses. Nobody's watching them. I could buy my house and turn it into a sober house tomorrow, right?
But let's
So
not.
that's
But let's
gonna
not.
increase.
But let's not forget that the people you're describing, the people that are in these sober houses, are our brothers and sisters, are our parents, are our children.
I completely understand that. I go into these sober houses 365 days a year. 365 days a year. I have people who I think are absolutely wonderful, and I would sit and talk to them for hours if I could. I have people where I make sure that my back is not to them, that I have a clear view of the exit at all times. So yes, there are very wonderful people, but there are also some very, very scary people. And we need to admit that. We have to admit that. Not everybody is the lawyer or the nurse or the mom who's having trouble with their pain pills from their car accident. That's not the case. And it's not about the fact that we need these services. We know we do. It's where they're going and what you're doing to protect our kids.
No, he was ready.
Hi, I have so many things to say. I don't want to spend all day here. I have a few points I want to ask you. Number one, do you have statistics on you said there are, I don't know how many people that have had, overdoses in Barnstable. How many of those people lived in Barnstable? How many of them came from another place, went to Gosnold or another treatment center, and ended up staying here and overdosed? That's number one. Number two, I've lost so many, I've had like 4 things I want to say, forget most of them. But I would like you to address the incident that happened. Is Emerson House one of your, would you like to address the incident of the AK-47 with the drug dealer waiting outside of there for one of your success stories?
I'm not familiar with that, but we could certainly look into that.
We don't need that next to a grade school. We don't need anybody showing up there. It's well known that drug dealers meet the people when they come out to give them drugs. We don't need that next to a grade school. We don't need people showing up with weapons. You had it happen at your one of your facilities already, and I know you do a wonderful job. We can't take a chance for one mistake to happen there. And also, one other thing, you have a facility up in Terhune that you're saying is wonderful, which is wonderful. Why don't you add the extra beds that you need? Do an addition there. Why do you need to go where you're talking about going? Build where you are. I just don't see the advantage to our community for you to put this facility next to a grade school.
We have other people. In a minute. Okay, this gentleman's been waiting.
Hi, my name's Richard Sturdivant. I just want to say a few things. I'm sure everybody here, no one here is against having another facility. It's definitely the location. Gosnold saved my life. I've actually been there quite a few times, but I know a lot about the place, and it's not perfect. There are people there that can be dangerous. The fact that she said they don't ever leave without anyone's not true. I work for Falmouth Taxi. We pick people up on the corner out there that can't get in all the time. We bring people there that are wasted out of their mind because they have to be to get in. And it's crazy. I've seen them run into the woods, go drink more before they go in there. Like that, where are they gonna go at that facility? They're gonna run behind the school to get high real quick? Like, because I know that is how it is. They have to be high to get in, right?
No, that's not true at all.
Because I was denied for that, for not being high, and I had to go get drunk and come back to get in.
That's not.
No, I'm just asking, honestly.
And I'm telling you that it's absolutely not true.
So
That's not
why'd
true.
that happen to me? That's funny, because I know more people that's happened to, too. I've actually brought someone from your facility to the liquor store and then brought them back after they drank.
Yeah,
and I didn't pick them up again, so you obviously let them in then.
Yeah,
but
I can't speak to your specific instance, but I can promise you, I've been in this field for 30 years.
Yeah.
Insurance companies don't ask people, or we don't ask people to go out and get drunk or high
But
before we
people
admit them.
do leave your facility. You can sign out and walk right out, and they can walk right up the driveway, and you can't stop them. I know that.
No, but our plan is to transport anybody who wants to leave the facility
To
to
where?
where they need to be. There won't be people walking around Jones Road.
Okay. And too, like, also, while I was in Gosnold, drugs can get in there. I don't know about recently, maybe you changed, but it wasn't like that the few times I've been there. So how are you gonna, so drug dealers are gonna be cutting through the schools, like that will happen? Most likely it's at night, that's usually how it was when I was there, but I just see a lot of, I think the location's crazy, and you're gonna keep the other one open still, right?
No.
Oh, you're closing that one.
No, we're not. If I didn't make that clear, my apologies. We're looking to relocate our services. We're not going to keep Terhune open as a patient facility. It's going to be support services going forward.
So the town's a huge town. Why right there?
It's the facility is perfect for the needs that we have. We didn't want it to be next to a school. I mean, ideally, it wouldn't be next to a school. But for us to continue to provide the services we need and expand, that's the location that seems to be the perfect site for us.
Okay.
And I want to address, there was somebody who said, why don't we build where we are? For those of you who don't know, we don't own the facility at Terhune. That's not a Gosnold, we don't own that building. You know, well, that's not true. That's not true.
One other quick question. When I was there, one of my roommates was a registered sex offender. How does that work? Because they're not supposed to be near a school, so how does that work?
to my point a few minutes ago, we won't be accepting sex offenders.
So you'll deny them?
That's correct.
You
Or,
wouldn't-
or,
you
or
wouldn't
relocate them to, or refer them to another facility when we find.
Okay. Well, you said, yeah, but you said you don't know if they're registered sex offenders.
We
So
can.
if you don't Cory check, how would you know? Like, they could just lie and say no.
Can't legally Cory check everybody who comes into a facility.
So I could be a registered sex offender and just lie to you and get in.
Yeah.
So now you have a registered sex offender 10 feet from my daughter's school, right?
For those people who we don't know, we cannot Cory check people, but I can guarantee, somebody was looking for a guarantee at one point, I can guarantee in the 30 years I have been treating this population, and I have run multiple institutions like this in the course of my career, I've never had an adverse reaction with a sex offender in any of my facilities.
Today I read a 49-page report of all the police incidents at Gosnold, sex in the woods, all kinds of arrests, drugs being used in the parking lots. How are you going to stop all that? You can promise that will never happen because it's near the school?
I'm not in a position to make promises, but I can tell you that we will have security, as Beth described, something we have not had at Gosnold. We understand it's near a school, and we understand the concerns of the community. Our utmost concern is to protecting the kids and the residents of Falmouth.
Because I'm honestly all for it. Honestly, I have no problem. I love Gosnold for what they did for me, but I just don't like the location. It bothers me. Even though my daughter only has 1 year left, but I know so many people that will have kids going there for the rest of my life. Like, it's just, I don't know.
Hi. Oh, you got it. Thank you. I, too, am also concerned about the Morse school issues, and I just had a couple points. One is that I noticed you mentioned for your dually diagnosed, you do mention depression, anxiety, PTSD. I notice you're not mentioning a bipolar population or a schizophrenic population. I'm sure you'll also be treating those. The other thing is, I wonder about your recidivism rate. You know, how, I think that is actually pretty high. I'm sure that your staff is excellent, but you also mentioned many of them are previously addicted people. They can walk in and out of the facility.
The staff is
Yes,
describing.
of course.
Yes.
And you mentioned many of them were
Yes.
previously addicted people.
Yes.
And there is a high recidivism rate for addiction. So that's a concern. The other thing is, you haven't mentioned, though I'm hearing that you want to build a fence and do things for Marsh School. When Royal Nursing Home was there, the staff often went through the woods to the senior housing area, which is also a vulnerable population. A lot of people know seniors have drugs within their homes. So I don't hear you making any accommodation for, you know, that potential.
Yeah, the plan is certainly to put a secure fence wherever we feel and wherever the town feels is necessary. Yeah. No, we hear, yeah, I hear all of your concerns, and these are all of the concerns that we have been dealing. Go ahead.
I just want to say that you know, a lot of the questions are based on assumptions related to the stigma of addiction. Is really kind of amazing. No, I I'd like to just finish my comment. I just want to, can I just finish my point? Because I want to talk about the fact that, you know, people who voluntarily seek treatment there may be on occasion things that happen in the environment, like this gentleman mentioned, which does happen. We actually have that under really good control, or else there would be incidents after incidents at our treatment center which do not occur. The assumption is that people in recovery are going to be breaking in and stealing people's medications. So those are the things I mean about stigma, that I think we also just need to check in on our own thinking, that if substance use disorders affect all of our families, then these are our families that we're talking about. These are the people in our families. These are our brothers and our sisters. So, I think that what we can talk about from our perspective is in preserving that site, really continuing our record of exceptional security and safety, which we do have, and expanding on that in ways that would bring comfort, if that's even possible. I'm not sure that that's possible, but that's our aim, is to have an open dialogue between the school and the neighborhood to find solutions where the school and the neighborhood would feel comfortable with the facility being there. I just wanted to add that.
Oh, yeah. Hi, my name is Nancy. I don't really need it with my Irish whisper. My name is Nancy Quake. I'm a longtime Falmouth resident. I do work at Gosnold. I served on the Falmouth Substance Abuse Commission for 9 years. I was part of the creation of the Falmouth Prevention Partnership. I was an original member of the steering committee. And I really want to talk about the children and what I learned about prevention science in this business. And I also am a person in recovery almost 33 years. I am that person. I picked up my first drug when I was 12 years old, and I want you to know that. I bought my first bag of weed when I was 13. I want you to know that. I come from a happy, beautiful, I did come from a happy and beautiful home. I was raised right. I think we're shortchanging the kids, and I think we need to talk about making this a teachable moment, because it's not only at 359 Jones Road, the problem is all over town, and I can tell you where they are. It's in the Walmart parking lot. I can go on and on, okay? And we need to educate our children, because let me tell you, I also know from the prevention piece of it, if I'm not mistaken, the age is usually around 13, correct, Patty? 12, thank you, when they first start to experiment. So at 11 and 12, when they're in Morse Pond, and as parents, it's our responsibility to have that conversation with our children, not just about 359 Jones Road, but about the world and about what's out there. I think we're shortchanging our kids. I think we need to have this conversation with them. And I really think it's going to be okay. And that's our responsibility to them. Thank you.
My name's Michael Gaius. I'm a recovery manager for Gosnold on the Cape. I work off Cape and on Cape. I work with men coming out of treatment, helping them get reintegrated back into their lives. One thing I do just want to address, because it's a very fresh situation that just happened to us at Gosnold, and I can address the sex offender thing. I had a patient that went through Gosnold, and he was, at the time at Katomet, he was a level 1 sex offender, which in the state of Rhode Island. The state of Rhode Island runs everything based upon a board does the judgment call on the type of level that he is. The young man relapsed, and it took him 6 Narcans to come back to life. We brought him back to Gosnold, a level 1 sex offender, went through G1, went to Katomet. While he was at Katomet, we were planning on his aftercare. His aftercare was going to be done in Falmouth. He was going to go to the Miller House. We would not place him because he had a judgment pending in Rhode Island that was going to change his level. When his level changed, we did not put him in the Falmouth population. We found another more secure facility with a higher level of care that went there. He went somewhere else. Also, before he even got to Falmouth from Good Samaritan Hospital in Brockton, Clinton, Mass., which does all of the monitoring for the sex offenders in the state of Massachusetts, because they all have bracelets, anklets, bracelets, whatever you want to call them, because I have release forms from all of my patients, so I know their doctors call, their therapists call, their probation officers call. His probation and his monitoring system called me before he even left the hospital to let us know that his bracelet had been cut off from an MRI. The very next day when he came here, I brought him to Barnstable County Jail and had the bracelet restrapped. Then the process went on to assure that he was going to be in a facility or an environment with a level of care that was going to keep him safe and the community safe. That's what we did. Thank you.
Hi, my name is Tony, and I drove all the way down here from Boston, Massachusetts tonight to speak on behalf of Gosnold. My son was a patient of Gosnold, and they saved his life, and he wasn't a criminal. He wasn't a rapist. He wasn't a sex offender. He had never been arrested. He just was a drug addict. And so there are sex offenders, rapists, criminals all over the country. You walk down the street, you pass them, you don't even know they're there. To say that drug addicts that are going to be going to Gosnold, and it's almost, in my opinion, you're treating them not like people who need help, but you're labeling them as, criminals. And most of them are people who just need help, like my son. Second thing, your point on the 15%. Yes, sir. I wonder what that 15% would be if they were allowed to accept more Falmouth patients. It would probably go up. I'm just saying. Right now, I'm saying that it's, right, I'm saying that it's,
If the man addresses me and asks me a question,
I'm saying that it's 15%. But if they stayed where they were,
Okay.
and they turned more Falmouth patients away, it could be more than 15%. You don't know that.
That's not how statistics
Okay?
work.
Well, I'm just saying, they're trying to say they need more beds to accept not only more Falmouth patients, but more patients in the area, in other counties. Okay, so that's why they need to expand. Third thing is, I think that Gosnold and the respect that they have for people like me and for people who have patients there, they're going to do everything they can to make sure that the area is safe. So, you all have questions about what they're going to do. You should turn those questions into making them do those things. Okay? If you have questions on how they're going to handle this and how they're going to handle that, I'm sure if you say to them how, instead of saying how you're going to handle it, you should say, we want you to handle it. Okay? And I'm sure that they will accommodate as best they can, knowing from what I know, to make the area safe. Okay?
All right, here we go. All right. July of last year. Cape Cod man overdoses on heroin, crashes SUV into telephone pole in front of Gosnold. I have a couple questions, so just hang in there with me. Now, if that last year happened next year at this time, and you guys were in over at Jones Road, and that was a kid and not a telephone pole or a group of kids, where would we be? Okay? I'm 6 years clean this October. I had 2 unnecessary back surgeries because I like to get high off Percocet a lot. It consumed me. So for anybody to think that everybody doesn't get it, you're wrong. I get it. My sister's been addicted to heroin since I was 15. She sold her body for drugs. So, for the mass amounts that think people don't get it, I have 4 kids. I want them to have better than I had. So I'm going to continue with a couple of things that I put together. Who is Gosnold's medical director?
Dr. Barnett.
And where does Dr. Barnett, actually, I'm good with this. Where does Dr. Barnett stand on this issue as far as you guys moving over?
I haven't spoken specifically with Dr. Barnett. Dr. Andrew Mann is our psychiatrist, medical director for outpatient, and is supportive of this.
So your medical director for the facility has not been checked with. That's just, I just want to make that clear. Okay. Now you say it's a safe facility because it's there's a locked unit, right? That's what we're talking about. We're talking about a locked unit.
One of the units, correct.
One of the units, right. So my mom worked at Center for Optimum Care for a long time before it was Genesis or whatever it was. I worked in the kitchen for about 3 years. So upstairs, that far wing is where they took care of all the Alzheimer's patients.
Thank you, I'm sorry.
They're not paying me though. I don't need that. I'm good. That's fine. So, yes, no problem at all. So your locked unit, what makes that different than what you're doing right now? Why does somebody need to be held against their will versus being able to just walk out the door? What's different, and why is it still safe for children next door?
A locked unit is for patients who are not safe to be able to be outside of the secure environment. So there are patients with serious depression, anxiety, and to somebody else's point, bipolar, correct. So we are treating that population. We are treating that population because they need containment and they need the security of that unit. They also have a co-occurring addiction. Currently, Gosnold does not have the ability to treat this population, and this population is being referred outside of Cape Cod and outside of southeastern Mass. These are Falmouth residents. We are referring Falmouth residents outside of Cape Cod. We are referring multiple Cape Cod residents outside. So this is a secure facility, and patients are not allowed outside of the building. That makes it secure.
And so do you guys have experience with locked units as of right now?
30 years. I've been running locked facilities and locked hospitals throughout Massachusetts, throughout New England.
How about the staff here? Because you have a job fair posting right now to bring all new people in.
Not for this unit.
So there's 5 of these in the entire state, right?
That's correct.
Locked units. That's what separates.
5 dual diagnosis units. We're not talking
What makes a
psychiatric
dual
unit.
diagnosis?
It's licensed by the Department of Mental Health and licensed by the Department of Public Health. These are specialized unit to treat this population. Again, only 5 in the state.
So you have 30 years in the field. Do you have a security firm in mind which you'll be using?
There are many hurdles to get over before we get to the point where we're hiring new staff or looking at security.
But you're at an information session that's going to try to tell us why we should be calm with it going next to our school, and you just admitted that a locked facility is for dangerous people. So I'm kind of hoping you would have your security in place before.
Well, we're not, with all due respect, we're not going to hire. No, can I respond to the question, please? We're not going to hire a security staff.
So right now, what is your staff to patient ratio right now?
Are we talking about the detox? Are we talking about the rehab? Or are we talking?
Terhune Drive.
I'm sorry?
Terhune Drive, or Terhune, however you want to pronounce it.
So is it 8 to 1? 8 to 1.
And what's your turnover rate right now?
Turnover rate in terms of staff?
Yeah.
Lonnie?
19%.
If they violate security.
Hold on.
what
He's in the
happens?
middle of a sentence,
I
please.
mean, somebody arrests them, you call the police? That's all I wanna know. Somebody said that.
What is the policy for is it elevated? Eloped?
Elopement?
Thank you. What's your policy for that sort of patient?
Currently or going forward?
Currently. Yes, currently.
Detox services and rehab service are voluntary services. So patients don't, there's no security here. Patients are allowed to come and go as they please. They're allowed to leave the facility as they want.
Okay. And how about a Sentinel
Thank you, sir. We
event?
have to give other.
What is your plan if a Sentinel event occurs at this new facility next to the school?
Do you want to explain what a sentinel event is?
You can.
Do you know what a sentinel event is?
Absolutely. I wouldn't have written down. I mean,
So there are very specific protocols that we have to follow for licensing boards regarding a sentinel event. There are notifications. It's what we currently do and we've been doing for 46 years.
so where can we, as a public, get a copy of that information?
Would you go to the, I can go to the.
Serious event.
A serious event like, for example, a death on a 24/7 premise would be an example of a sentinel.
Correct, correct. I'm
There are very specific reporting requirements for under our state licensure and to the Joint Commission, our national accreditation.
And can the public get a copy of that information for what your current policy and
Sure.
procedure is for that?
Absolutely.
And where would we get that from?
We can make sure everybody gets it if they want it. Sure, it's all public knowledge. Rick?
Hi, my name is
Wait.
Millie.
Hold on. Go ahead, Rick.
Hi, everybody. My name is Rick Martin. I'm the Director of Risk Management for Gosnold, and I do handle the incident reporting. Just a couple of clarifications just to make things clear. I've been in this position since 2010, where I've handled all of the incident reporting for our company. We have 0 incidents of any patient who voluntarily leaves our facility engaging in any type of child sex or any type of sex offense or any sex offense whatsoever in the community. Right. Secondly, as far as to answer the last question about it's policy 5.11, incident reporting and sentinel events is the policy. It specifically requires us to report sentinel events to the Department of Public Health, to the Joint Commission as well. That's a requirement of them. We also have a policy regarding reporting these events to our insurance carrier as well. It's open for the public, and anybody that would want to read policy 5.11 is welcome to do so. As far as incidents, accidents, assaults, we had, since July of 2017, as the attachment that you have here, you can read this tonight, we've had 347 police visits, according to the Falmouth Police Log, which we monitor. 75% of those were just medical transports and or situations that involved false 911 calls. The remaining issues were police visits to our site. These incidents overwhelmingly occur, and I'm sure any nursing staff here can concur with me, occur inside our facility. They're usually the result of a call from our staff member inside the facility. Very, very, very few of these incidents occur outside. I just want to make that point clear. We have no, to my knowledge, complaints from any of our neighbors on Jones Road, either JML. I've never received a phone call, and I handle those phone calls from JML and or a private residence that's immediately next door to our facility. These events just that we're talking about regarding people climbing fences, throwing drugs, these events simply do not occur. I've been in this position since 2010. There are incidents where the police are called, of course. We're a behavioral health facility. But those incidents, none of these incidents occur that are being described here that are causing fear with regard to child molesters, situations like that. They simply do not occur. So I would simply ask that we let facts take place of fear. Thank you. Yeah.
The AK-47,
I can relate to the AK-47 situation resulted at the Emerson House approximately a year ago. And it had nothing to do with Gosnold patients or Gosnold stuff. It was a vehicle that pulled over to the side of the road, had nothing to do, was not related in any way, shape, or form to any Gosnold staff member or to any patient at the Emerson House. These were individuals who were just in our community who happened to pull over the side of the road near the Emerson House. Check the police reports. Those are the facts. Thank you.
Hi, my name's Millie, and I feel very bad for the people that abuse drugs, are on drugs, and for their families. But I personally know a nurse that worked there, and he was attacked, and he's out on disability right now. I also know many people in town that are on drugs, and they do drugs, and they go into these facilities for 7 days, come out, and then they're going back in for 30 days and come out, and it's a constant in and out. Now, this woman here, I forget her name, that got up and spoke, and she said, we think everything will be all right. Well, thinking everything will be all right is not good enough. You're feet away from public school, and I'd like to ask you and anyone there that's in charge, would they want this facility that close to their house? Would you? Would you want to have those people right next to your house, and why don't you take them in your neighborhood?
So let me respond, okay? Let me respond. We do know that relapse is part of this illness.
Oh, yeah.
It's a symptom of this illness. We at Gosnold understand that, and we respond to that appropriately.
Yeah, it's heartbreaking.
We also know that if we're not addressing the co-occurring issues, that the underlying mental illness that could be causing this patient's substance use disorder, we're not treating the whole patient. We do know that if we're treating the whole patient, the reoccurrence of relapse and the recidivism drops. That's our hope going forward. And let me answer one more point. Again, 30 years in this field, I would not have a problem with this facility next to my home.
Number two, if you're talking about, people reoccurring, first of all, they sign up for 30 days. When you go into any kind of a rehab, you should not have to go less than a year. It takes a year to be away from people that you do drugs or drink with. So you should be there at least a year. You can't sign up for 7 days. That's nothing. You're back out in the bar room or on Walmart and getting the next fix. That's just how it goes.
The difference between detox and rehab, you may be a bit misinformed. So detox is really medical detoxification, which is somewhere between 3 and 5 days. Rehab is somewhere between 3 and 5 weeks. So yeah, there are a number of patients who choose not to go to rehab and leave after detox. Again, it's a voluntary program. We can do our best to convince people that this is how we know sustained, lasting recovery is. But again, we can't convince everybody.
Can you guarantee that if you put that facility there, nothing is going to happen?
I think I said earlier, I can't give that guarantee.
You can't guarantee, and then you're going to have a lot of lawsuits. And you're going to have children that maybe have problems because of it. So that's on your conscience if this goes through. It shouldn't go through. There's another place you can open it, whether you're not right next to a public school.
Hi, my name is Rachel Zano. I'm a 6th grade teacher at the Morse Pond School. And my classroom is directly, the last classroom that's directly next door to what will be the facility, which I have questions about a couple of things. One, I work very late at night, sometimes till the closing of the building, which is 11 o'clock at night. I leave the exit of my building, which can sometimes be dark and not lit. So yes, you're saying you're going to do the fence or the wall or whatever. That's nice to hear, because I do worry about my own safety leaving the building. In addition, as a science teacher, I take my class out to the back of that area that you said that you walked, and I have my class down there all the time. So I want to know, what are you going to do for that access, that lower ball field, or the lower field we call it, in the sense of access to the pond? Because I have kids that do science experiments directly with the pond water. So what should I anticipate when I see something or somebody out in that area? I know you say that people aren't, but the reality is they do. People, they're, mental illness and drugs, and that takes control of people. So I want to know, what are you going to have in place for that when I am taking my class outside the school and going through that? I would hate that access would be blocked because of your facility being there, because it's a great educational opportunity to use the pond, to cut through. We cut through for a running club as well, and I'm always running the kids back and forth between Fuller Field and our school. So I use that all the time. So how will that be addressed?
So we saw the space you're talking about. We can certainly provide security around that space, but the bottom line is we'll do absolutely whatever is necessary to maintain the security and make sure that you're able to use that. Yes.
But when you say that, I guess I need more reassurance as to what is that. You keep saying you're going to do everything, but what is everything? I don't know what I don't know. So what do I do when I see a person or somebody? I don't know. So call me ignorant. I just don't know what I don't know. What am I going to do when I have my class outside and there's a person out there that doesn't belong there? We already have people that kind of take residency in the woods. And, you know, even that's scary sometimes to our kids. But I need more in my tool bag, because let me tell you, I have plenty of kids whose parents sadly have overdosed, more than I can even possibly imagine. And so our kids do know, and we talk to them about that. There's no, we don't know anymore, because it is so rampant on the Cape. And I'm all for having a facility to help people, but I want to know, how are we going to be safe, and our children are going to be safe, and what is going to be in place? I guess that's what I need to know. What is going to be in place? And you telling me you're going to do everything, I don't know what that is. So what is everything?
So our commitment to the town and to the people who are concerned tonight is to develop an advisory committee, because we don't know what the concerns are other than what we're hearing tonight. So we will work with the town, we will work with the teachers, we will work with the parents. We'll develop a committee, an advisory committee, long before this thing is built or open, to address the security and address the concerns of each and every one of you. I want to hear what you need to feel safe when you leave that building at night. I want to hear what you need as you walk out that door with those kids for their science visit. So when I say whatever's necessary, whatever's informed that we need to be secure that we're going to provide what is necessary for all of you.
I guess my fear is that whatever everything is going to now inhibit what I do in my classroom. And I would hate for that to be the outcome, that no longer can I use that back exit. I can't park on the side where I've been parking for years, because they don't want me walking outside in the dark, where I am totally comfortable right now walking outside in the dark. And not being able to go down and use the pond anymore. I don't want those things to be the outcome of the facility being next door either.
Neither do we.
Hi, my name's Allison LaRusso, and I just want to start off by saying that I fully support your mission. I think our community and this whole area really needs it. My only concern is about the location. I truly wish that you had not chosen such a controversial location. Recovery should not be this controversial. It is a need for everyone. So my first question is, have you had a dialogue with the Falmouth Police Department and the school committee? And if not, is that your next step? And if so, you said in the paper that construction is going to start this fall. Are you willing to slow down your plans in order to meet all of the needs that need to be met before you go ahead with this?
So we have met with the chief of police and the police department, and we have met with the school committee.
And
No, you have not. Nope, you haven't. You haven't met with us. Sorry,
so
Melissa
we-
Keefe, I'm actually here as a mom, but now I'm just hostile. I'm sorry.
So
Reel it in a minute.
So we
You've not met with this
Patty,
one right
Patty,
here.
who came to the breakfast?
Nancy Taylor came to your retirement breakfast that you hosted for her as a retirement party. That was not an informational session.
No, but we have spoken with people.
That is an informal.
Okay, I get your point. Fine, I get your point.
Okay, that's fine. That's okay. Melissa Keefe, I'm actually here as a mother and a parent and a homeowner and a lifelong resident, but I will let, just full disclosure, I am also a school committee member. You've not met with us. I am totally appalled that this is even a consideration to have this facility, which, let me tell you, also full disclosure, I'm a registered nurse with the Commonwealth. I appreciate addiction. I appreciate everyone having the opportunity to get themselves together. Honestly, from the bottom of my heart, I support people in addiction. It's a tough road to recovery, and I understand that a symptom of that is relapsing. However, this facility is 98% perfect for you. Center of town, not on 28, except that 2%, that tiny little 2% is a giant 2%. And it's not going to come on the backs of the kids of our community. It's not. I'm sorry. And I appreciate that you want to purchase a building and you want to get JCO approved and you want to get DPH and DMH. And again, I applaud that and I support that 110%. But the rate of movement in this town, I feel as though your goal of, breaking ground this fall is a little aggressive. Unless there's more to this story and you've had conversations behind closed doors that we've not been privy to. And by we, I mean the community. So is this a done deal? Number one. Number two, I've checked the zoning board agendas and I've not seen you on there, nor have you approached school committee to ask us our thoughts, because we speak for the town as well. So I wonder what else is happening? And please, and another question, why are you not adding on your current facility? Because your neighbors don't complain, because there aren't neighbors up there other than other facilities up there. You don't have homeowners and neighborhoods across the street and schools next door and senior facilities behind you, and you don't. You're not in the center of town up 200 Terhune. You're not. So help me help all of us understand why building an addition on your current location isn't possible, and why the undertone, the big elephant in the room, is that everyone wants to know, is this a done deal?
So it is not a done deal. As I said, in terms of the timeline, the first step was the community meeting. We have not gone before the zoning board. We have not purchased the building. We wanted to address the town first. That's why you don't see our name on the zoning board, because we've not approached them yet. So no, it's not a done deal.
So again, this was a little, you said you haven't approached the zoning board. You said that you approached the school committee. You didn't. You hosted a retirement breakfast for our outgoing superintendent last week. Very thoughtful. However,
We have a meeting scheduled with the chair of the school committee, correct, Troy? And the superintendent.
I'm sorry. Hold on. Why is Troy
involved?
Why is Troy involved? He's not a member of the school committee.
Troy's been helping us in terms of guiding us around. No, I did not say.
You said you met with the school committee, and now you're taking that.
I met with, we had conversations with school committee members during an event for Nancy Taylor.
Excuse me, I don't think it's false information. I think Richard met the new superintendent as well. I think that's
No,
what.
he said he met with the school committee.
He misspoke, and he meant that
Well,
he.
Richard can talk for himself. He's been talking all night, so let's have Richard talk. You meet with the police as well? Or
I
not?
met with the outgoing superintendent. I met with the incoming superintendent around this issue. And I had a conversation, during an event, we had a conversation with a school committee member.
So let's just clarify that that's not meeting with school
I
committee.
understand.
That's a casual conversation, so you need to take that off the table, because that is not how school committee operates. We do not operate individually. We operate as a committee on a whole. So if you want to speak to all of us on a whole, you can certainly call the ad building and get on our agenda, and we are more than happy to talk with you.
We will do that.
Otherwise, please don't say that you spoke with us, because you, sir, have not.
Explain why
She's going to bring it.
I think one of the key, several people have hit on it. Why isn't the existing facility, you said you're leasing it, and I believe you're purchasing this proposed facility. Why isn't the existing facility expansion a possibility?
So currently, the land is owned by Cape Cod Healthcare. We own the building. Or actually, we don't own the building yet. We will at some point. It's not good business sense to think about continuing to build on a facility that we don't own the land. So the hope is that we could actually have a facility that does not jeopardize our mission going forward in the patients we serve.
50-year leases on leased facilities and things like that.
The lease is
I'm just, I mean.
Yeah, our current lease is up in 4 years.
But it doesn't really, I think that's one of the concerns. I mean, the physical location, obviously.
No, we get it. I understand. We get it. We listen.
Maybe if you look at that alternative, explain it, that a little bit more detail, why that isn't a possibility. It might help with the other alternative.
Hi, my name's Tracy Waggett, and I just want to first of all say that I think we're all here because we love our community, number one. I want to recognize that Gosnold does a phenomenal job of helping people. No matter how many times it takes them, they do help people. I want to commend anybody in here that is battling addiction of any kind for being sober for 1 minute. So I thank you and commend you for your struggle. We need a facility, that's no question. But do we need it next to our school? I'm very, very concerned, not just for the safety of the actual students that go there, but for the teachers who now have to have another thing that they have to worry about to protect their students from. They are teaching our children, and they are teaching in a way that they never had to 30 years ago, because we didn't have lockdown drills when we were kids. They didn't have the threat of somebody coming in and harming a children. The doors were all open. Now the doors are locked, and they have that burden. And I would hope that nothing would be done until a conversation is had between your facility and how you're going to make it safe, and every single one of those teachers, not just Ms. Zano or any other teacher. Every single person that has the burden of keeping our children safe has a voice, and nothing should go further without making sure that they are okay. Thank you.
I just want to be cognizant of time. We have about 6 minutes before we have to vacate the room. Are there any other questions?
I'm the Reverend Sarah Maria Allenby. I am the spiritual care advisor at Gosnold at Katomet. I've heard a lot of interesting things here tonight. I'm a mother of a son at Morris Pond School, and I know that Gosnold's going to do absolutely everything that needs to be done to make it safe. You know, my concern, I hear all kinds of stuff like us and them and us and them in the room, and there's just us in this room. We're just human beings, right? And we talk a lot about the opioid crisis and all the addicts, those people, and we haven't talked a lot about alcoholism, which is pretty much everybody if you stand in a church many times. The idea that people get treatment is what is the issue. The issue is that we get treatment and that we get help and that we get the help we need. Because again, there's no us and them. It's just us in the room. Every single person in this room knows somebody who's been in treatment or who's had treatment or has the neighbor who's in treatment. And I think the most important issue is to make sure that they get that treatment. And Gosnold is going to do everything when we get there at that point to create a safe facility, to create, you know, the needs for people. People, when they get to treatment, in early treatment, they are broken. They are broken and sad, and they're primarily lying in bed feeling like crap. They're not wandering around. You know, I've been at Katomet for almost 4 years. I treat more people who are broken in spirit than anything else.
I was born and raised in Falmouth. I went to Falmouth schools, went to college, came back. I'm a nurse, registered nurse. I work in community health. I work with people with dual diagnoses every single day. I'm in the trenches dealing with, you know, our problems as a community, and we have problems. I have a couple of questions for you. I also have children in the public schools, one of which will be in 6th grade next year at Morris Pond. My question is, so folks in a dual diagnosis unit, this is that, you know, locked unit that some people are referring to, do they have smoking privileges?
No.
So a person with schizophrenia who also has an alcohol abuse problem won't be allowed to smoke at Gosnold?
I mean, the hope is that we would try to bring them outside, but that depends on the patient's clinical presentation.
So there's a chance that they will be outside.
Well,
you cannot deny. I work in community health now, but in the past I have worked in rehab facilities, in mental
in a
health
psychiatric
hospitals.
Yes,
Yes, I have done
okay.
some time.
So you
Butler
know that
Hospital
DMH requires us.
requires you to allow smoking privileges to its patients.
No, that's not true. They allow us, because most of healthcare facilities these days are non-smoking. So that's not
Right.
true. So
Okay.
really what we're required to allow them is time outside,
Okay, so everyone's allowed time outside. So how will that look?
depending on the acuity of the patient. So if a patient is not safe to go outside, the patient would not go outside. So
Okay.
it's
Who
it's a clinical-
determines
it's a
safety?
physician, the medical director of that
So
unit.
Dr. Barnett would determine this one can go
No,
outside?
it's not. Dr. Barnett is a medical doctor. It would be a medical director would be a psychiatrist.
Okay. So some folks might have like Q15 checks, others might have hourly, I mean, there's all different.
It would always be Q15 on an inpatient unit like this.
Okay, so it's always, so that means every 15 minutes, someone would have to lay eyes on that person for those not in the medical fields. So that's one, I mean, I am concerned, that, people being outside and smoking, I mean, that's a violation of being in the school zone, so I'm wondering about that. Also, drug use in a school zone, that's a federal offense. Would you prosecute on that? So I'm curious about those things. I also want to know, just by a show of hands, who in this room works for Gosnold or has an affiliation with Gosnold's? Because I feel like I'm at a staff meeting or something, to be honest with you.
Is here?
I'm Rachel. I'm an alcoholic in recovery. First off, this is a nod to Gosnold that they do a wonderful job. Like the times like relapse is part of my story. I understand the concerns of school. I love children. I have nieces of my own that are young that are going into 6th grade. I respect everybody's opinion about what the mission is for our community as a whole. But I can tell you from my experience when I was at Gosnold, when there were people that were difficult, they handled it properly. They took them, if they were getting sick or they needed more help than they could offer, they sent them to a different place. Now, you guys can have like your little peanut gallery with your opinions or whatever it is. I really think that like you're giving an unfair viewpoint of alcoholics and addicts. Excuse me, I'm talking. Please do not interrupt me. I gave you your respect. Please don't. I really feel like that there's this stigma, and yes, there is one out there. Yes, we want to help everybody, but not everyone in the health community is so forgiving and so nice to everyone. I've heard more times than not that people get turned away when we're at our lowest. And if you haven't struggled with it or don't know anyone who has struggled with it, it really is truly defeating to not be able to be accepted in somewhere. And sure, we do have to go off Cape. Some people come here because it's their last resort. What if they die? Have you ever thought of that? If they die, if someone's parents or family has to lose them because we turn them away? Because of, okay, you know what? Yeah, I'm not talking to you. Excuse me, but really, just think about it.
Hi, I first want to say that Gosnold does an absolute wonderful job. I'm a parent of a Morse Pond student right now, but I also have a family member who still continues to struggle with alcoholism. He's been in and out of Gosnold many times and is still struggling to this day. As a matter of fact, just last week, he tried to get a bed. He lost his job because he just can't get out of the hole. So, this is very near and dear to me with what you guys do. And, he's been struggling since high school. He's almost 50 years old, and he's still struggling. So, on the other side, as I watch him struggle and know that these services are needed, I also know what he goes through, how he is when he's using. I have driven him to Gosnold myself. And, when you're using, you're not in your right mind. He has, used before going in. He has to get his last fix before he goes in for detox. So I have concerns with it being right next door to a school. Nip bottles being left, needles. Teachers do not need to be policing the playground for needles or nip bottles and things being thrown over the fence. My brother has urinated in public because he's been drunk out of his mind. What about indecent exposure happening? I know you guys do what you can, but
you're not Superman and Superwoman either. You can't guarantee that nothing's going to happen. And again, I support your mission and what you do, but really, it really needs to be done at a different place, not next to a school. And it's right next door. If it were down the street where Kuna Messett is, or something like that, where it's a little further away, steps away, like where it is now, it's down the street from VNA Child Care Center. It's not right next door.
Build a Nimrod. Why don't you build that in place? Last one.
Go ahead.
What's wrong with you going somewhere else? Excuse me, ma'am, one more.
Hi, everybody. I've been in AA for 40 years, and AA saved my life. AA saved, or Gosnold, and AA saved my son's life. So, and I don't have a dog in this fight because I don't live in Falmouth. I'm from Barnstable. We used to beat you guys at football a lot, by the way. Anyways, for over 20 years, I went to AA meetings. I don't go so much anymore, but, and AA meetings are everywhere. I mean, everywhere. There's no supervision. There are no cops. There's nothing to do about security. How many incidents has anybody heard of something happening at an AA meeting? AA meeting, the program of AA has saved millions of lives. And people say to me, how'd you quit? I didn't quit. I went to AA. I was going to lose my family. And I went to AA, and I hated it. I thought they were a bunch of losers. And for about 6 weeks, you know, I'd say the right thing and all that stuff. And anyways, and one day it hit me that it was me. It wasn't my job, it wasn't my wife, it wasn't anything, it was me. And the way that people get into recovery is from somehow learning. There's no learning process, just going and getting into AA and listening to other people, identifying with what they've gone through and have come through the other end. And I don't know how many people I heard. I would say to myself, if that guy can do it, I can do it. So I didn't quit. I couldn't quit. And that's what addiction is all about. Gosnold puts people on the road to recovery. They have recovery facilities in the beginning, which is a hell of a lot harder than as time goes by, to get people on the road. You know, addiction is everywhere. Anybody in this room not affected by addiction, whether it be family or friends or anything like that? What's going to happen when your kid comes home and he's got to go to a hospital somewhere? He's so screwed up on drugs or booze. There's got to be these facilities. I know you guys got fears, and I don't blame you one bit. But talk with these people. Don't accuse them of things. They're not trying to hurt you or get something over on you. They're trying to help the community.
It's just saying you're against
the location only, sir.
Location only.
Just the location.
Thank you.
Wait a minute.
Put
They
it on one
said
fifty.
that
We'll help
her
you
brother
build.
had to have a fix right outside the building, and many of them do that. So that's right next to a school. That's a federal offense.
Thank you.
Put it somewhere else, we'll help you build it. Honestly, we have no
He said
problem
he
with
built it next to
that.
his house. Like Gosnold take a lot of houses in your neighborhood and have them there. Go build your building. You can afford it.
So we really need to stop, but this is exactly why we wanted to do this tonight. This is why we did, before we went before zoning, we wanted to hear the concerns from all of you. We understand this is a difficult subject. We're happy to do this again if we need to. We appreciate your time and we appreciate your comments, and thank you for coming.